I'm currently doing my geriatrics fellowship, and when I got the email for the Immunizations Toolkit, actually my first reaction was, well, this is going to be another project. I've already got a case presentation coming up, a journal club, so many projects, and but at the same time, I thought, you know what, this is an opportunity because this is the kind of work that I actually want to do after fellowship. Everybody's asking me, what do I want to do? And I knew that I want to be a part of, even before I applied for my geriatrics fellowship, I knew I want to be a part of the long-term care setting. And I said, this is actually a project that's directly about that. Like, how do we make things better in the nursing home? And I can actually be a part of that directly. Like, that's going to be an amazing opportunity. At the very least, this is a way for me to become more aware about immunizations in the nursing home. But to be a part of creating something for that, I thought this is an amazing opportunity that I have to jump on. So from the experience, I think that working together, collaborating with others that are interested in long-term care immunizations. I think that a lot of us are actually part of the Futures program. So we're fresh geriatric fellows. We're going to have a fresh perspective on long-term care. Not only will I be able to build relations with people that are in different states, and we can combine our efforts and our experiences in order to make even the next version of Toolkit better. So keep improving the Toolkit so that our patients can do better. And so what I hope to learn is that our implementation, is it actually making a difference in our nursing homes? Is this something that we can spread? And is this a way for me to become further involved into AMDA and the committees and everything? So I think that the toolkit, the reason it's so important is that, so for example, before I got that email about the toolkit, I did not even know toolkits exist or even what CPGs are or anything. All I knew is that, okay, I had my medical school education, I had my residency education, now I have a fellowship, and I'm gonna go right into nursing home care without any, maybe a mentor to help guide me, but that's gonna be based on just their experience. But just like in residency and fellowship, I go to UpToDate to find things, or I go to particular resources. I did not know that there are actual resources. I did not know that AMDA makes so many policies and guidelines and that they have toolkits available. So not only will I have something at the very least, I have something to refer to as a clinician or, as a healthcare provider, but I will have something that I can actually improve. And knowing that resource is out there, like I'm learning that in geriatrics, so much of the guidelines and rules we're developing it as expert opinion and based on evidence from multiple providers. And so everything is in flux. It's not like in med school, residency, fellowship where everything's already, that's been studied for years. There's already evidence-based. A lot of this we're learning as we're going. So knowing that these resources exist will allow me to also spread them and give providers a source for them to go to, a go-to source. And that's why we're taking the previous toolkit, and when we had our meeting, I said, this toolkit's like 50 pages long or 60 pages long, and we're not going to have time to go to that. So let's just completely revamp this project. Let's make it very simple. We want our providers to be able to actually use it so they can jump to the section they need. So it's exciting that I can just make a new project out of something that's already there instead of being restricted. So I think that this project, I think it's a great opportunity for us to, be able to improve care in the nursing home. And I think that, bringing us on as geriatric fellows, I think that's the best way to go about it. We have, people that we can talk to. We have resources. We can look at what others have done in the past. So I just think that it's a great opportunity, and we can, do a lot of great work with it.